I'm glad to be a patient of Dr. Lewis's, and he's wonderful, very well, just bedside manner was excellent. His knowledge about the procedure, he answered all of my questions. He never made me feel like I was uncomfortable with him. He always made me feel comfortable, and just a very personable physician. And sometimes that's hard to find, but you can definitely find that in Dr. Lewis. Hello, my name is Erica Lee, and I came to Dr. Lewis in October. Was actually how I met or came about with Dr. Lewis is I met one of his staff members at the bridal show. Had no intentions of getting to this point. However, speaking with Erin, she shared more. It was more of cosmetics, facial, and then we got into the conversation of breast reduction. I've had problems, if you will, with large, heavy breasts. They interfered with my working out. I had neck and back problems. Really didn't know it was because of that, because you would wear your bra, you just go on about life, not really thinking, okay, do I have extremely large breasts? Anyway, speaking with Erin, she shared with me some things, and she asked various questions. For example, one thing I can remember, do you have grooves on your shoulders? And at that point, I kind of took the bra strap aside and looked. I'm like, yeah, I really do have grooves. And really just not knowing that the weight from my large breast pulling on my shoulders caused a lot of neck and back pain. I would even wake up with shoulder pain, just not knowing this was a contributing factor due to extremely large breasts. So, sat down with Erin, made an appointment, came in and saw Dr. Lewis, and of course, a little nervous because any kind of surgery, it's surgery. Complications come about, you have all these ideas, how am I going to look after this? But I can say Erin really calmed my nerves, and then also speaking with Dr. Lewis, he shared with me this is what you can expect. There were even pictures that I could see before and after of other clients that also kind of put me at ease. But again, it was still surgery, but I decided to go forth with it. The surgery was performed on the 16th of August, and even then, I was still a little nervous, but everything turned out magnificently. I was surprised at number one, how quickly I healed. The second thing I enjoyed, I like the way they look. It's no longer on my lap when I take my bra off. They're perky. And of course, every woman's body is going to be different. Your breast is going to take a different shape. However, after the glue came off, they don't use stitches. I really like that fact that I was glued together. It sounded kind of interesting, but being glued together is definitely better than being stitched together. And coming for the post-op exams, Erin was just absolutely wonderful. Even though I was kind of freaking out how the glue looked, but she said, don't worry, it will come up, and it did. And now here we are, January, almost 3 months? Let's say October, November. Yeah, about 3 to 4 months out, and I love the way I look. No more neck pain, no more shoulder pain, no more grooves, and I just love the way they look. They look like breasts now. They're not down here, and I absolutely love the way I feel. I can work out more. I've actually lost some weight since then, and my goal is to continue to drop weight. Preparing for a competition, which was in May, but now it's in July, so it gives me more time. And 6 months from now, or 5 or 6 months from now, I know I'll look even different. But the alleviation of the pain has been incredible. And I am so glad that I met Erin at this bridal show, because I wouldn't be at this place. I know I wouldn't. I would still be dealing with the pain, with the suffering, and just not knowing that these things contributed to my neck, shoulder, and back pain. So the surgery, like I said, was a success. The healing process took time. Everyone heals differently. Erin is always there. She answered all of my questions, even those times when I wasn't feeling good or just not knowing. she really provided me that comfort, and it was sincere. When I called her, sometimes I felt like I was bugging her. She's like, no, you call me. I don't care. Call me. And she always put me at ease, and I'm glad to be a patient of Dr. Lewis's. And he's wonderful, very well, just bedside manner was excellent. His knowledge about the procedure, he answered all of my questions. He never made me feel like I was uncomfortable with him. He always made me feel comfortable, and just a very personable physician. And sometimes that's hard to find, but you can definitely find that in Dr. Lewis.